Dr. Heather Hurlburt and Dr. Alice Kim with Care New England's cardiovascular program talk about women's heart health and the signs and symptoms that we should all be on the lookout for.
Right, the traditional risk factors that we think about when we see our patients are things like diabetes, which typically we see in probably the older years, smoking, which we can see in many years, family history, so genetics, obesity with a sedentary lifestyle, and abnormal cholesterol. So that doesn't, we can see that certainly throughout the years 20s, 30s, 40s. Mm-hmm. And as women get older and go through menopause, that also is a risk factor for having heart disease.
There has been an association with stress and depression and the development of heart disease in women. There is a feeling that the pro-inflammatory state from adrenaline and being under stress can contribute to heart disease in that state. Mm-hmm.
So chest pain is really a very typical symptom for both men and women, but we know that women can also have some what we call atypical symptoms for having a heart attack. So other symptoms like just feeling very overwhelmingly tired, short of breath, having symptoms just in the jaw pain or maybe just arm discomfort, certainly those could be signs for women for having a heart attack.
And a lot of times women won't say pain particularly, but they may describe it as a pressure-like sensation. Other common symptoms could be upset stomach or GI complaints. Sometimes people think they're having indigestion, lightheadedness, dizziness, or just fatigue. So oftentimes our advice is that any new or concerning symptom to you that is not something you're accustomed to is worth getting checked out.
What about pregnancy? Can that be a risk factor in itself?
So what we're seeing is in pregnancy, things such as high sugars, so gestational diabetes does, in fact, in the future, may have a role in developing heart disease. Mm-hmm. Also, people who have high blood pressure, maybe before their pregnancy, certainly should have that controlled, and also may develop high blood pressure during their pregnancy. Mm-hmm. That also could develop into having risk factors for heart disease.
Pregnancy is such a complicated time because you have so many different symptoms related to the pregnancy and all the changes your body is going through. But in general, good prenatal care where we're having blood pressures checked frequently and blood glucose levels checked frequently can pick up on a lot of these things, and they are important down the line. But in general, I think the symptoms would be very similar to developing when you're not pregnant. Mm-hmm. And oftentimes can go unnoticed, like with diabetes or high blood pressure. They're often silent and are not detected unless they're checked for.
All right, thank you.
Thank you.